Hi all, welcome back to Nursing Guru. So today we are going to start another live session which is regarding the community health nursing. Okay, so hope you guys are hearing my voice. If any disturbance is there, please let me know. I'll give you time. Okay, so how are you all? How is going on your exam stuffs? Have you writing properly the exams or any kind of things? If you want to share with me, kindly share, so that will make sure you to be come out from lot of doubts. Okay, so we can discuss together and we can get a solution together. So that is why just a second, yes. So for showing you guys this one. Yeah, for showing this purpose. Okay. Yeah, so this is the thing that which we can able to go and discuss. So here you could have seen that, my dear students, this is all about the previous year question papers. Okay, so that also you could have get it in the internet itself. Okay, so that I won't tell you where the things are going to be helpful for you, or you need to be go here only. If you want means you can get it in the Nursing Guru application also. You can download it and you will get there. Okay, so those are available in application also. Okay, so now we will start our class. So tell me, what is our exams, how is going on, have you finished properly? Anything you want to tell, you can tell. Why? Because if you tell means I come to understand what is the things we need to discuss. Okay, so anyhow we are doing the examination series, prediction series. Okay, so in that prediction only coming, most of the things are coming in this prediction only. Okay, so first year JNM, it will be quite easy for you guys also to get pass in the examination, especially. But if you gone through first attempt was lost, no issues, second attempt is this, so you will definitely get past here. Okay, so my thing is what I'm telling you, better how to write the exams. Okay, so how to write the exams, how to um, answer the questions, how differently you have to answer to the questions, and that will make sure you to be one of the important things to know before going to write the examination. Why I'm stressing this point? See, you people are going to be appearing second time, which means you lost one attempt. Okay, it's okay if you lose, it is okay. That is a less strategy. Okay, strategies are very important over here than the how much the professional things you have, like blunders you studied, blunders, like in the examination hall, the only the student mindset is to be finish it off the things very fastly, very soon. Okay, so that is why whatever the things it will come to our brain, that is what you are going to be write it down. Okay, so let me clear, you should not write the things blunders. Okay, so why? Because blunders were going to be lose your marks. Okay, so whatever the story you will write, nobody will going to give a marks for you guys. Okay, hope you understood. See, in this community health nursing, we have around 8 to 9 units are there. So yeah, different parts it is going to be divided. Okay, so in each and each every segment we have different units. So initially we have 9 units. After that, in environmental hygiene again we have 5 units, and nutrition part we have the 6 units, 6 to 7 units we have. Okay, so these are the things which will be there inside the community health nursing. Okay, so let's start my class. Little bit of my voice is not okay today, so adjust with that. Okay, so tell me in the chat box. Hope you guys are writing your exams in a good way. Okay. So for this na we have cleared. Okay, so here what it is be happen, we have in the first community segment we have a 9 units. One by one we are clarifying this. Okay, so first unit is introduction, you know that. Okay, so from the introduction we are expecting the questions like, you know, the concept, based on the concept principles. Okay, so the quality of community health nursing and the nurse especially, and what is community health nurse. Okay, so that is the thing we are going to be supposed to know. The first unit is going to be teach about the introduction to community. Okay, so always in any subject you take in any course. Okay, so first unit will be introduction to the community health. Yeah, introduction to the community health. Here we are going to mainly focus on the things like, you know, definitions. Okay, definitions and terminologies. Okay, what is community? Community is a group of people in a geographical area. Okay, terminologies. Okay, so the next one is definition of health, community health nursing. Okay, so then disease. Okay, so disease also is one of the very important thing. Okay, so that and all will becomes here, and we have history and development of the community health nurse in India and its process concept. Okay, how it has been evolved. Okay, so nowadays you if you see in the government sector or anywhere that we have a focused area which is related to our, so which is related to our things like, you know, we are focusing more on the people's health. Okay, so group of people we have like, you know, in the urban area, in the rural area, we are giving much importance for the community health in the current scenario. Understanding means nowadays. Okay, so here what it will be happen, the primary health care, millennium development goals and millennium development goals, and promotion and maintenance of the health. Okay, so these are the things which we are going to study in the first unit. Okay, so now I will tell you in the first unit itself. Just a second. Yeah, first unit itself, what will be happen, we have focused on the things only, the concepts of the community health nursing. Community health nurse means what, definitions of health, illness or disease. Okay, so and indicators of health, dimensions of health, determinants of health, you have to focus. Okay, so only that much it is there. Okay, so hope you guys are getting the things. So now we will move towards the things, you know, second unit, that is what, community health nursing. Okay, so this is first unit is community health, that much only. Second we are going to be the community health nursing. Okay, so it is a specialized area where we are going to treat a group of people who are present in the community to take care of the vulnerable group, focusing on the vulnerable group. I will explain you. Okay, so unit number 2. Unit number 2, what you have to focus, my dear students, here you have to focus on the things like, you know, just a second. See, here it is a specialization area. Okay, so where we are going to be get the things like you are going to provide a care for the people. Okay, the concept, it is provide a framework for providing a practice in nursing. Okay, so in complete nursing means not only providing care for the whole are coming for the hospital. Okay, so only hospital people we are providing, huh? No, okay, we are focusing on the community as well. Holistic, okay, holistic care we are providing, which means whole, okay, whole in the sense including everything, okay. So, same while it is also provide a framework to provide care for the people who are in the community, focusing on the community. So, we are providing care in the community. We will, that is the motto of community health nursing. Okay, understood? Okay, next one we will move towards the things philosophy. Certain philosophies are there, sorry, certain philosophies are there. So here the philosophy of individual right being healthy. Yes, everyone's right is that you have to be maintain the proper health status. Okay, so that is there. Next thing we will go with the philosophy of working together under a competent leader. Okay, so that is the philosophy which will tells you that in the nursing we have to work together. Okay, team wise we need to work under a competent leader. Okay, so certain competent leader, so the primitive ages of human that mean that has learned to live together to meet their needs. Okay, so who will be a competent leader, under them we have to find some of the team and we have to work together productively for getting the betterment of the community people. Okay, so certain philosophies are there. What are the goals then? Okay, so in this community health nursing, goals are very important. Then goals are like increase the competency of families, groups and communities, deal with the health and illness problems. So vulnerable group will comes under the community. Okay, so we have the pregnant women. Okay, pregnant women, and we have the under 5 year children's. Okay, so next we have the postnatal or lactating, postnatal or lactating mothers we have, and especially elderly. Okay, elderly, these are, okay, pregnancy women come means antenatal care, antenatal, internatal, okay, and postnatal we need to provide them. Okay, next after this under 5 year clinic means we have to see the nutrition things and all. Okay, so to avoid the malnutrition, okay, malnutrition, kwashiorkor, okay, marasmus, everything will come, so that we have to check, keep on working on the under 5 year people. Okay, next one is that postnatal. Okay, so lactating mothers, so August 1st to 7 which week, so that is the breastfeeding week. Okay, so let me tell you, okay, so there we need to educate, as a nurse we need to educate the people towards to maintain a proper idea for feeding the babies. Okay, so fresh mothers and all, their lack of education, as a nurse you have to go and implement your knowledge on the people. Okay, so you have to encourage them to gain the knowledge regarding the certain health benefits, especially regarding communicable diseases, breastfeedings. Okay, so lot of things are there to educate the people. That is one of your goal. Okay, so community health nurse goal and role also. Next one, control, respond to the physical and social environmental conditions which are threatening to the health or hamper normal living. For example, any kind of environmental hazards which will be taken place, we have to have the control towards that to save the lives or to maintain the proper health of the people. Okay, next one is that, so the goals will be there, principles. Okay, so the principles are like community needs, understanding of the criteria of the community health nursing. Okay, next one, family as a unit, you have to see family as a unit, respect the values and customs, integrated education and counseling. As a nurse you are acts as a educator, so you should have a knowledge to educate and provide a counseling for the people who are not having a proper knowledge towards the healthcare benefits. Okay, Next one, collaborative work. Okay, so you have to be have the collaborative work skills to work with some other teams and gain the good knowledge. Okay, so these are the things which will be there over there. Next one, continuous evaluation. Whatever the things you have provided, so you have to focus on the things that to evaluation of your work. Okay, next one, ongoing education or continuous learning and service supervision. You have to learn properly. Okay, so certain principles are there, no, so you have to gain the education by integrating and upgrading your knowledge from one year to another year. Suppose we have lot of schemes are has been launched from past post independence era to till now. Okay, so lot of things are happened in the community health nursing. Okay, or else are community medicine. Okay, so lot of things are there, means what you will do as a community health nurse, you have to upgrade the knowledge. Okay, you have to upgrade the skills according to the trends. Okay, next one is that service supervision. Service supervision, qualified CHN staff members who overseas nursing services give direction and guidance for the task at hand. Okay, so task at hand, so service supervision will be there. Recording and reporting are the main principles of the community health nursing. Okay, importance of community health nursing. And so we have the what is the community health nurse qualities: educational qualification and communication skills, observation skills, then ability to lead and take a decision. Okay, autopsy should be maintained by each and every nurse, not only community health nurse, every nurse. Okay, so you should have the capability to make a decision at certain time. Okay, so even if you get a emergency patient, what you will do, you have to have the knowledge to gain the you have to have the knowledge to be take a decision at the proper time to save the life of the patient. Okay, next one, we have other qualities: ability to lead and take a decision. Other qualities, okay, she should be knowledgeable, she should be understand the human behavior, she should manage the managerial abilities. Okay, so by working it will be inbuilt by yourself. Okay, by seeing, by observing, these are the skills. Especially when we were studying, you know, observer, educator, counselor, and we used to tell no lot of things. By the time we are experiencing the things like only for our exam purpose, we have learned those roles. Okay, once you join the job, literally by inbuilt it will come to you that you will going to be definitely follow those roles and responsibilities as a nurse. You may experience that one. Okay, next one, we have a functions of community health nursing. She acts as a planner, good observer, nursing care provider, community organizer, coordinator of services, and trainer or health educator. Okay, so health monitor, role model, change agent. Okay, so recorder, reporter, statistician. Okay, so these are the role of nurse or functions of the community health nurse. Pakka they will ask a question on this: qualities or functions of the community health nurse. Elaborate the qualities and principles and functions of the community health nurse are one of the high yielding topic. That is why I am explaining you. You have to thoroughly know about this. Next one, we will move with the roles. So health community health needs assessment, risk identification, source mapping, resource mapping. So planning, when it comes to the planning, program development, resource allocation. When it comes to the implementation, this is the process. Okay, so these are the process. Role and responsibility of a community health process in the assessment. Okay, in the assessment, the nursing process will be there, no, assessment, planning, implementation, evaluation. Those four areas will be there, no, there. Assessment, in the assessment, community health needs assessment. Okay, so you have to assess the needs of the community health. Risk identification, you have to do the risk identification, and as well as you have to focus on the things like resource mapping. Okay, so resource mapping is also one of the important area. Next one, planning. Okay, so when it comes to the planning, I will tell you, you have to develop the programs in the community, and resource allocation you have to do in the community. Those are the planning the nursing process. Okay, next one is that implementation. In implementation, preventive, promotive and outreach to the community. So we are providing the holistic care now. It is including the preventive, promotive and curative kind of care we are providing nowadays. Okay, so that is why. Then evaluation, data analysis, feedback mechanism and monitoring the surveillance will be the role and responsibility of a community health nurse in the all of the nursing process: assessment, planning, implementation, evaluation. Okay, so that is how you have to write the role of nurse. Okay, so hope you got it. Now I will next move towards the differences between the community health nurse and hospital in institutions. Okay, hospital or institutions, so that difference you study, and nursing process also you know very well. And this unit is over, so those are the important questions that what I have told you know. That is very very important questions. So define community health nursing, enlist the objectives of community health nursing, describe about the principles of community health nursing. Okay, so there may be a chance to ask these questions. Okay, hope you guys are understood this much. And now in Instagram, who are watching, hi all, how is going on your exams? Hope you guys are getting good things at your exams. Most of the things are coming whatever we have discussing right now, so the same things we are expecting there also. So hope you guys are writing in a good way exams. Okay, so have you, if you have any doubt, you could have you could have asked me in the chat box. Okay, so and one thing I will explain you, don't ask about the result will be definitely come by August. Okay, so once you are finishing your um, practical exam, definitely you are going to get the result. Okay, so there is no doubt in that. Hope you understood very well this. Okay, so other than that, any questions which is related to community health nursing first? Okay, so first years you can ask me. Okay, now I am in the second unit, that is community health nursing. So in that I'm telling the second important questions. Explain the importance of community health nursing process and write about the qualities of the community health nurse. That what I have told you know, that assessment, implementation, assessment, planning, implementation, evaluation, that process, and the roles and responsibility and the qualities will becomes under the, for example, planning means program development, program allocations will be there. So those kind of qualities and the responsibilities you have to write it down according to the process, nursing process. Okay, so those are very much important. Okay, so now, so now I will next move with the briefly explain the steps of nursing procedure is one of the question, and write down the goals of community health nurse, give a principles of community health nurse and give the functions of community health nurse, and write a short note on principles and objectives and community, sorry, objectives of the community health nurse. Okay, so there those area, and a difference between the institutional nurse and the community health nurse were very important. Okay, so these are the things you have to focus more. Next I will go to the health assessment. Okay, so unit number 3, health assessment. So assessment means what? What we are doing in the assessment, it is a practice in which require the patient data or collected and analyzed for diagnosed patient centered care. Okay, so for diagnosing something we should know, so assessing we have to collect the information. Data means what? Information. Okay, so collecting the data for the diagnosing the care. Okay, so diagnosed based on care. Okay, so based on the diagnosis of the patients we are providing the care. Okay, so that is all about the health assessment. Okay, so here also objectives are important components like taking history, physical examination. When it comes to the physical examination, inspection, palpation, percussion. Okay, so those are the things, auscultation and percussion will come now, so that you write. Okay, next one, characteristics of the healthy individual, that is important. General physical appearance, speech, head and neck, posture, hair, scalp. Okay, so that entire physical examination parts will be there, no, that you study. And social characteristics. Okay, here should have a good relation and should be harmony with family members, society and the community. That is one of the social characteristics. Okay, spiritual and cultural characteristics. So those are the characteristics. And mental characteristics, these characteristics you have to study thoroughly and go to the exam center. Okay, so next I will move with this. So here you can see that health assessment of infant. Okay, so there also introduction is, sorry, history collection and physical examination for infants. Okay, so infant will be there. And health assessment of the preschooler based on the age wise they have given. School going children, and we have health assessment of the adolescent. Okay, so different age group, whatever the health assessment procedure which will be taken place now according to the health assessment, what we are doing, how we will collect the, for adolescents and all, we used to collect the menstrual cycles history. Okay, menstrual history, obstetrical history. Okay, history of current systemic illness or past history of illness. Okay, so those are all things, different things which will be taken place according to different age group, right? So those are things you have to focus. And health assessment of the postnatal, after the baby, whatever the things we are supposed to going to collect the history for further care, that you have to study. And adult and elderly, that is what geriatric people, that is also one of the question. Okay, so next one is that you have to take a question, write a short note on the characteristics of healthy individual, that mental, spiritual, so that is what mental characteristics, social characteristics, general characteristics will be there, no, physical characteristics and all. So those are, you have to write it down. Okay, hope you get my point. Okay, so now I will move towards that enlist the common health problems of the school going children. Certain common health problems will be there in the school going children, that you have to study. And what are the components of the school health program? Okay, so here only school health program which will come. So most of the time you study about the assessment. Okay, so next one is antenatal care, postnatal care also you may expect. Okay, then write a role of nurse in school health program, and write the health assessment of antenatal mother. Okay, so these are the things which will be there in the particular unit. Next one, we are moving with the fourth unit. Okay, so fourth unit, once again I will recall this health assessment. So all age group from the infant till the elderly, all health assessment criteria you have to study. Okay, next one is that characteristics is very important, don't forget to study those characteristics. Okay, so social, physical, general and mental. Okay, so that community health nurse. Okay, so that characteristics you have to study. And next is that you have to focus on the things like, you know, postnatal care, antenatal care, and we have to focus on the things like, you know, school health program and role and responsibilities of a nurse in a school health program. Okay, so those are very important, you have to focus. Okay, so next one I will move with the principles of epidemiology. Okay, so the principles of epidemiological methods. Okay, epidemiological methods here means, epidemiology means the study of disease and health outcomes in the population. Okay, known as the epidemiology. Okay, so what it will be teach you means the study of distribution and determinant. Suppose we have a COVID pandemic. Okay, so by the time we are come to know the things, what is the criteria of the disease condition, how it is spreading. Okay, what is the structure of the particular disease condition we have studied now. So that is what epidemiology. Okay, so we are going to study about the disease and health outcomes in a population. Okay, whatever the outcomes of the health and as well as the disease condition we are studying in the which one, epidemiology. Okay, so unit number 4. Okay, unit number 4. Okay, so I will tell you unit number 4, principles of epidemiology and epidemiological methods. Okay, and its methods. Okay, so and its methods, sorry. So these are very important things. Okay, next we will move with the aims of epidemiology, methods of epidemiology. See, observational studies, descriptive studies, analytical studies, and experimental studies. In that also field random controlled. Okay, so those studies will come. That is not a big task for you. So after that, basic tools to measurement in the epidemiology. So you are going to study here no that vita statistics, in that also morbidity mortality rate. Okay, so in that you have to study about the infant mortality rate. What is the formula for IMR, infant mortality rate? Okay, next one, case fertility rate. Okay, so case fertility rate, maternal mortality rate, MMR. Okay, remember MMR. Next one, incidence rate and prevalence rate, morbidity rate. Okay, so morbidity rate, that also death to case ratio, that and all different formulas are there that you study. After that you are going to study about the epidemiological triad. Okay, so epidemiological triad will be there. So here it is a agent, environment, and host. Okay, three things will come in the agent. Okay, so in the agent what will be there, we have virulence, infectivity of the pathogen, and addictive qualities of the substance of abuse are going to be mentioned in the agent. What is the reason? Okay, next one, environment. Okay, sanitary conditions, social context, or availability of the healthcare, etc. we are going to see in the environment. Host, genetic susceptibility, resiliency, and nutritional status or behavior we are going to subjected in the host. Okay, so agent is a microbe that causes illness in question. Okay, so we are going to tell in the agent is a cause. Okay, microbes. Okay, so infectious things we are going to mention there. Host, it is an organism which is infected by the agent. For example, human being is infected by the mosquito. Okay, so next one, environment. Environment is external element, morphological things to get the disease condition. Which environment? Through. Okay, so through the bad drainage we are getting the disease condition. Like that it will be there for your understanding. I'm telling. Uses of epidemiology, the study of history of disease, community diagnosis ಮಾಡೋದಕ್ಕೆ, which means we are going to do that one, and look at risk individuals as their affected groups or populations, assessment, evaluation, and research. Okay, so completing the clinical picture we are going to use, and here you have to focus on the disease cycle and spectrum of disease. Okay, spectrum of disease, that is also important. And focus level, spectrum of disease, we have that subclinical infection, clinical infection, mild illness, severe illness, and fatal illness or death. Okay, so these things will comes in the spectrum of disease. Okay, so like this you write. So here you write subclinical infections. Okay, so next one is clinical infection, mild illness, severe illness, and fatal illness, and death. Okay, so that will comes in the spectrum of illness. Levels of prevention of diseases, primordial prevention, primary prevention, and specific primary prevention and secondary prevention. Okay, so these things which will become, and fourth one is tertiary prevention. Okay, last stage of the pathogenesis. So this is the very important primordial, primordial prevention. Next one is primary prevention, second type. That is what? Pre-pathogenesis. Okay, pathogenesis means development of the microorganism. Okay, so next one is that specific protection, sorry, secondary prevention and tertiary prevention. These four phases you have to study. Okay, stage or phase. Next one, disease transmission. Okay, so how the disease will going to be transmit, the root of disease. Okay, reservoir of the infection. There are two types: human reservoir and three types. Okay, the human reservoir and animal reservoir, and we have the non-living reservoirs. Okay, so these are the things which will comes here. Here you can see that transmission, direct transmission and indirect transmission. Direct means direct contact, person to person direct contact, droplet infections. Okay, contact with the soil, bite of an animal, and transplacemental transmission. Okay, so syphilis, hepatitis or AIDS. Okay, through the sexual contact you are going to get the disease condition. Okay, so that idea you should have. Okay, so that idea is very much important, you to understand better about the things which is necessary for you to get the marks. Okay, so hope you guys are understood about my class. Now I will go with the things, next thing is immunization. Okay, so the immunization is very much important. Here also the transmission I left only indirect transmission. Indirect means vehicle borne transmission, vector borne transmission, airborne transmission, and fomite borne transmission. Okay, those four you remember. Okay, next I will move with the immunization. Immunization is that introduction. Okay, so in the immunization you have to focus on the immunizing agents. Okay, so the entire immunization schedule is very important. Okay, all the vaccinations you should study, and that entire schedule you have to remember. Okay, so hope I know that it is difficulty, but put it in your one of the wall of your room. Every day if you see, definitely you will remember. Cold chain. Okay, so now for tomorrow, study and go. How hard it is also, no issues, study and go immunizations schedule. Cold chain is one of the important thing, and disinfection and disinfectants, methods of disinfection. Okay, so those things you have to study thoroughly. And communicable vaccine, preventable diseases. Okay, so those are the things are very much important. And different disease conditions also you have to study over here. Okay, so all the conditions will come. Okay, and non-communicable diseases also you have to study. Okay, so hypertension, asthma, and diabetes mellitus. Okay, so those are things will come. Okay, take now the important questions. Okay, so the important questions are like, so it's all about the BCG vaccinations, immunization schedules, and we have the things like, communicable diseases, non-communicable diseases, and MMR. Okay, fill in the blanks you can expect. MMR stands for temperature in cold chain is maintained between dash to dash. Okay, so like this they can ask. Next, RNTCP. Okay, RNTCP means what? Okay, so this vector-borne diseases and direct and indirect transmission of the disease condition. Okay, so these are very important. Cold chain is also important. And next one is that define epidemiology and explain the epidemiological methods are very important. Describe the aims of epidemiology and factors affecting the diseases. Give the uses of epidemiology. Regarding the epidemiology, whatever you will study, I will always tell you to study according to the concept. Okay, so one concept you take and study, that will make sure you to be get any question they may ask, you can write, no. So that is the trick. Okay, so that is the trick you have to use. Next one is that, hi Sinchana, what's your doubt? If you have any doubt, comment. I think she don't have a community, simply she's attending the live. Okay, no issues. The next thing is that we have to focus on the thing. Uh, Describe epidemiological triad. How can you measure a disease and health outcome in the community? Discuss the levels of prevention of diseases that I have told you know, primordial, primary, secondary, tertiary. Okay, four things will come that you have to study. Next one, describe the modes of transmission of the disease. Discuss the national immunization schedule. I told you no, so that is very important. Unit number 4 was finished. Now I will move with the 5. Okay, so unit number 5. So in the unit number 5, we are going to see about the family health nursing care. Okay, so here no, family health nursing care is a group of individuals bonded together by a common interest of its members. Okay, so family means what? Group of people living under a same roof. Okay, so that is the issue, right? So that is the family definition, right? So everybody is, family is one of the important component of the community. Okay, so there we are mainly focusing on the families only. Next thing is that family as a unit of health care services, supportive system, health history, health promotion, caregiving, communication, and we have the health education and health advocacy. The concept are like biological concept, psychological concept, and economical concept, and sociological concept, and system theory we are using under the family care. Okay, next one, goals and objectives you have to focus. And we have a family healthcare services. So certain objectives of the family healthcare services and principles will be there that you study thoroughly and go from this unit. And certain family healthcare plan. Okay, so foremost thing it only will come. Okay, we have to maintain the certain family folder. There you will collect all the history of the family members, everything. Okay, so why? Because to provide a care for the each and every family. Okay, and individual present in the particular family. Then features of healthcare, family healthcare plan. Okay, so next is that family health nursing process. Okay, so components are assessment, planning, evaluation, diagnosis, implementation, and evaluation. Sorry, assessment, planning, diagnosis, implementation, and evaluation also we are seeing here. So in the assessment observation method we are using examination, questioning and listening, investigation and review of family health record, and discussion and conversation will be there in this one. Okay, so where it is there in the family healthcare nursing process. Okay, so same nursing process we are using, but whatever the methods we are using means what you will tell there. We are using observation methods, questioning methods, investigations, review of the family health records, and examination and discussion and conversations are the methods we are using in the family health nursing care or nursing process. Okay, next one, diagnosis. Diagnosis, same thing you will do. Planning. Okay, so the planning, analysis of the health problem, establishment of the priorities, setting goals, identifying the external and internal sources, formulating the family health and nursing care plan are the very very important factor. And implementation. What, Madam Sinchana, what you want? Hmm? Just a second, my dear students. Yeah, these are the things are there over here. Okay, next one is that implementation and evaluation. Implementation and evaluation will be there, no? So there what will be happen, what you are going to do. Implementation means what we have planned, no, that we are going to be uh, implement. Okay, so what we are planning, that we are going to be implement. Okay, so that is the implementation. Next one, evaluation. Evaluation, you know, 1 minute. Evaluation means whatever the care you have given, no, so that care you are going to be So evaluation means whatever the care we have given, right? So there we are not going to be um, assessing the things, already assessment and all finished, no. So we are going to be evaluate the care whether it is works or not. Okay, so pain, if we are going to provide a care for the pain, after in the evaluation, after the nursing care, we have the patient has been relieved from the care, sorry, pain. Okay, so like that we are um, writing in the nursing care plan, right? So that is the evaluation. Okay, next thing we will move with the, sorry for the disturbance, we will move with the family health services. So there also aims and objectives you have to study, and as well as going with the importance family services. Okay, so lot of things are there: antenatal care, intranatal care, and postnatal care will be over here only in the maternal health services. Okay, so whenever the maternal health services will come, you have to write it down: antenatal, intranatal, postnatal. Three you should include and write. Okay, so that will definitely gain a good marks. After that, neonatal care also you include. Okay, so those four factors should, must and should, which will be included in the maternal and child health services or the care. Okay, hope you understood this one. Next I will move with the functions related to the maternal clinics and home visits. Home visits are very important, so that is also you have to study. Educational functions, child health services. Okay, so child health services, I told you, know, assessment of growth and development, immediate care for newborn, care of nutritional status, prevention and treatment of the common childhood accidents, and immunization, educational functions, and other functions of a community health nurse. Okay, that much if you study, it is okay. Next one, family welfare services. I will tell you, definitely you will pass in the examination. Only the trick is that you have to know how to write the exam. Okay, so why? Because you know, it is, these are all very easy topics. Okay, no need to pressurize your brain that you have to give 100%, like, you know, 100% you have to give it for this subject also. But that is not much pressurizing subject. Especially I will feel a community is quite easy than other subject. Why? Because it's studying purpose, you may feel different things. Okay, so the next thing is that we have that role and functions of the community health nurse in the family health services: coordinator, provider, primary health care services, educator, okay, facilitator of family, and advocator and family care planner, change agent will be the role and responsibility. And health records, family health records, purpose of doing the family health records, types of health records: family folder, cumulative or continuous records, individual health records, process recording, and registers are the records we are using under the family healthcare records. Okay, so hope you got this. Next, important question from this you take. So define family, you may expect, give the goals and goals of family health services, write a short note on family healthcare plan, and list the steps of family health nursing process. The next one is that give, which one is there, that give the types of family health records that I have told you, know, those records you have to continuously write: family folder, cumulative or continuous health record, individual health record, and registers. Okay, so these are very important. And give the define family folder. Okay, so that definitions also study and go. That is one of the major important concepts, or the main area to get the questions from that portion. Okay, so next one is that explain family as a unit of health, write the principles and objectives of the family health care, write about the objectives and role of nurse in maternal and child health care, maternal services, child health services. Okay, so in the maternal I have told you antenatal, intranatal, postnatal, neonatal care. Four things you have to include and write it. Define family, long essay type of question. Define family, write in detail about the family healthcare plan and nursing process. Define maternal child health services, what are the objectives of MCH care, write a role of nurse in the MCH care. Explain in detail about the maternal and child health services. So this is one of the high yielding topic. Okay, whenever I am explaining, you have to know that where we are going to stress the things. Okay, next I will tell you. Hello, something is telling hi, someone is telling hi. Yaman, hello. So those are the important questions we may get. Okay, so glance, okay, family health, maternal health, sorry, MCH will come, no? So that time you have to include all those four factors, and neonatal care also you have to include there itself. And next one, child health care. Okay, so child health care, whatever the care you are supposed to be give for the children, assessment of the growth and development, okay, so immunization, so generally you can revise it, right? So if you study thoroughly means, definitely by telling itself, by listening itself, your brain will start to recall the things. Okay, so those are very important. Next one, we'll go with the family healthcare settings. Okay, so in that, home visit will be there. Purpose of home visit you have to study. Principles of home visit, like, planned and purposeful, regularity, flexibility, voluntary and convenient, developing relationships, scientific and update technique, educative and evaluative. Okay, so those are things are very important. Planning and evaluation of home visit. Okay, so and techniques of home visit. Okay, documentation of and evaluation of the home visit, merits of home visit, demerits of the home visit. Okay, so those are important. Home visit, the topic is important. Under the topic you have to include this much. Okay, next one, back technique. Back technique is one of the very, very important. Short note also you will get, and every technique you have to explain. Okay, so the steps you have to explain. Next one is clinic visit. Purpose, types of clinic, general clinics, maternal and child health clinics. Okay, in that also antenatal clinic, postnatal clinic, under 5-year clinics, 3 clinics will come. Okay, objectives of the under 5-year clinic, they may ask. Under 5 clinic is one of the very, very, very important topic you have to study. Next one, family planning or sexual health or reproductive health clinic will be there. Okay, so next one is child health, child guidance clinic and specialty clinic. Okay, so those are the things are very important. Examples of specialty clinics: diabetic clinic, respiratory disease clinic, neurology clinic, psychiatric, cancer, dental, cardiac, nutrition and immunization clinic. Role of nurse in immunization clinic you have to study and go. Functions of the health personnel in the clinics, that is what, nothing but responsibilities that you study and go. Take a questions. So write a purpose of home visit, list the articles of home visit bag, that is what bag, community health bag. Write the principles of home visiting. Okay, important. Discuss the planning and evaluation of the home visiting, and back technique also you have to study, and write a short note on home visit. Home visit is one of the very, very, very important. Advantages and disadvantages of the home visit. Okay, so short notes, back technique, clinic. Okay, types of clinic, under 5-year clinic, you can get the question. Okay, next I will move to the referral system. Okay, so the referral system is very much important. Here we are seeing the primary level of care, secondary level of care, tertiary level of care. 3 levels of care will come. So that 3 levels of care you have to thoroughly study. Okay, the purpose also you have to study. So village level, sub-center level, then primary health, PHC we used to send. After that we will send the community health center, after district hospital, then after teaching hospital or the specialty hospital, multi-speciality hospital we will refer. So this is the levels of healthcare settings. Okay, so that you have to study, that will comes in the, okay, so that will comes in this particular unit. Okay, that you study. Then secondary level of care, so and tertiary level of care. So these 3 you have to study. Steps used in a referral system: establishing good relationship with the patient, establishing a need for the referral, setting objectives for referral. Okay, so that is also important. Importance of referral system, and role of nurse in the referral system. So from this unit you may get that triad system, levels of healthcare, steps in referral system, responsibility of a nurse in the referral system, write about a selection of the patient for referral. Okay, so referral system is the eye yielding topic here. Okay, so there is a chance to get from this particular unit. Next we will move towards that records and reports, that is the 8th unit. So in the 8th unit, records and reports, principles of recording and reporting. So here you may going to answer in such a way that purpose of record and reporting. Okay, so 8th unit. So in the 8th unit, reports, oral reports, written reports, 24-hour reports, census reports, accidental reports, change of shift reports. Okay, so then transfer reports and other reports. So these are the reports will be there, my dear student. Hope you understood, right, this one. So these are the things like, types of reports. There may be one question. Okay, types of records, cumulative or continuous record, family record, anecdotal record. These are the records. Briefly describe, observe the behavior, that important evaluation done by the community health nurse during the home visit. That is called anecdotal records. Okay, so in the records, cumulative, family, anecdotal, clinic, doctor order sheets, nurses sheets and other records will be comes under the types of records. Okay, yeah, have you any doubt? If you have any doubt means please let me know. Then reports also, oral reports, written reports, census reports, accidental reports, change of shift reports, transfer reports and other reports will be there in the types of reports. Next one, use or importance of records and reports. Okay, so use of importance. Okay, so the purpose of recording and reporting, what are the purpose and types of records and all I already told. Importance of records and reports for patients, for doctors, for hospital, for public health and for education and research purpose. How it will be importance that you have to write. Okay, so essential requirement for records and reports also very important. From this unit you are getting the questions like, discuss the records and reports, give the principles of records and reports, and write a short note on the purpose of records and uses of records. Okay, so list out the types of records and reports, pakka one question, and write a short note on the cumulative records, mention the use of reports and records, mention the importance of records and reports. Okay, so then write down the role of community health nurse in maintenance of the records and reports. So this role, no, either they may ask also, not asking also, you should write and come. Okay, so if they are asking about the records and reports, after last of your answering, write about the role and responsibility. That will make sure you to get a good marks from your evaluator. Okay, so these are the things you should follow. Okay, so next one is that long answer type of question in detail about the records and reports used in the community health nursing. Whatever the types will be there, no, entire things you have to write. Then next one is unit number 9, minor elements. Okay, so minor elements are defined as a non-complicated medical conditions that can be self-diagnosed or resolved on their own or can be managed with over the counter of medications, OTC, over the counter of medications. Okay, so what I'm telling, this minor elements means, so certain things will be happen every day. Okay, suppose I will get a headache or some kind of conditions. Okay, so that is I will self diagnose, I'm getting headache, I can able to manage with that headache. Okay, so I'm not going to the doctor even it is not severe. Why I should go? So types of minor elements, general minor elements, systemic minor elements, two types will come. Principles of management of minor elements. Okay, so the next one is purpose of standing orders, types of standing orders, institutional standing orders, specific standing orders, general standing orders. Three orders will come. Okay, so next thing is that management of minor elements as per standing instructions. Fever, heat stroke, diarrhea, burn, dog bite, snake bite, and as well as we have the fainting and injuries or fractures. Okay, so wound and convulsions in the children, hemorrhage, unconsciousness, role of community health nursing in standing orders. Okay, so minor elements as per the standing instructions or the orders, these are the minor elements. Okay, so that can be able to self-diagnosed and treated by them itself. Okay, next, Joe Madhu, hi. Hi dear. Next one, role of community health nursing standing orders. That role you have to know, in general things only will be there. Okay, I'm not going to stressing that. Write a note on minor elements, classification of the minor elements, and standing instruction or order. Standing order in case of fever and diarrhea, whatever the standing order will be there, that you have to write it down. Okay, so those are very very important questions from this unit. Next, environmental hygiene. I'm not going to give much importance for each and every unit. It's all about 6 also. Okay, so 614. Next, environmental hygiene from that particular 10th unit, introduction to the environment. So the basic things only you are going to study here. Here the important is like, define environmental hygiene, write the importance of the environmental hygiene, write a short note on importance of healthy environment. Okay, next one, what is environment? Discuss the sphere and the components of the environment you have to study. Next, I will go with the 11th unit. In the 11th unit, so we have the things like it's one of the biggest unit. Okay, lighting, ventilation, housing, everything will come here. Okay, so there. So from the 11th unit, take down the questions: environmental health, pollution, rainwater harvesting, water pollution, air pollution, refuse disposal, noise, and describe the sources of water. List down the criteria for safe and wholesome water. The next one, explain the causes of water pollution, enlist the waterborne diseases, write down the disease spread by the mosquito, vector-borne diseases, okay, or only the spread by the mosquito. Next one, how rodents and can be controlled at home. Okay, so that is the questions. And short answer, write about the sources of water supply, write about the sources of water pollution. Okay, so whatever the major topics are there, no, that you study and go. Okay, so the next one is that write a short note on environmental health, waterborne diseases, disinfections of wells, and purification of water by rapid so purification of water by rapid air pollution and rapid sand filters. Okay, so rapid sand filters, air pollution, discuss the sources of air pollution and its effects on health, list out the causes of air pollution and methods of prevention, mention the hazards due to the air pollution. Okay, so next one, write a short note on the methods of waste disposal, disposable of solid waste, refuse. That entire method is there, no, that process that you have to write. The next one is refuse disposal, methods of refuse and RCA latrine. Next one is explain about the septic tank, waste management, housing standards, characteristics of good housing, ventilation, noise pollution. Okay, so types of standards and of ventilation, and state the difference between the shallow well and deep well. Okay, so differences means they will ask this one: shallow well and deep well, and slow sand filter and rapid sand filter, sewage and sullage. Okay, so those are difference between questions must and should study and go. And vector borne diseases and mosquito borne diseases, what are the methods used for the control of the mosquito breeding. The next one is write down the controlling measures for mosquitoes. Okay, so define safe and wholesome water, describe the different methods of household water purification, explain the uses of water and list out the waterborne diseases. Okay, so those are the things are very important. Write in detail about the water pollution, slow sand and rapid sand filtration. Explain the purification of water in large scale, purification of water in the small scale. That two questions they may ask. Next one, describe the effect of polluted air on the health and write the preventive and controlling measures of it. Explain in detail about the collection, transportation and disposal of waste. Okay, so slow down my video in the YouTube. Late ayo. Korach late aanu. Ai. What I can. It's okay, no issues. Define sewage and explain sewage purification in detail with diagram. Explain briefly the different methods of refuse disposal and write the characteristics of sanitary latrine and discuss the RCA latrine in detail. Okay, so that is one of the important question. What is the sound pollution, noise pollution? Okay, sound and noise both are same. State the sources of sound pollution and its prevention. What are the mosquito borne diseases? So those are the important questions you have to study. Community organization for health promotion. So national level, local level, voluntary, state and state government, social. Okay, so these are the things will be there. Here you have to see that the national agencies, okay, Indian Red Cross Society, Indian Council for Child Welfare, ICCW, Family Planning Association for India, FPAI. So these are the things will be there, no? So lot of things are there, local agency, voluntary agency, NRIs and all. So and the legislations and acts, regulations on the environmental hygiene is also there. National Green Tribunal Act, okay, Air Act, Water Act, okay, Environmental Protection Act. Those acts are very important. Study and go. Okay, so the questions are like, you know, international agencies, national agencies, Air Act, Environmental Protection Act, Educate, National Green Tribunal Act and Water Act, and discuss the hazardous waste management religious list and define 6 laws related to environment. Describe the legislation and acts regulating the environmental hygiene. Okay, so those are the things are very important. Next we will go with the health education. Health education part, it is you know, it's very easy for you to be know the health education part. Okay, so around we have in the health education one more part is there, nutrition. So around 25 units are there, dears. So we have here 13 to 19, 7 units. Okay, six units will be there. So each unit I will tell the important questions. First is communication skills in the health education and communication skills, that part. Okay, so from that that entire communication skills you have to study the language and verbal communicate. Language is sorry here communication, one question you will get, meaning. Okay, so that is a chance to get that question. And define communicational skills. Okay, next one is communication skills. Barriers of communication is very important. Explain the principles of communication, list down the types of communication, verbal communication, non-verbal communication. Okay, that list down the types of methods of communication and write the process of communication, list down the that process is there, no? We already told so many times that entire chart that you have to study and go. Next one is that write down the importance of communication. As a community health nurse, write your responsibility in establishment of successful communication. What is communication? Write the types and principles of communication. What is communication? Discuss the different types of communication. Communication and explain the process of communication in health setting. Define the health communication and explain the elements of communication are very much important topic from this 13th unit. Okay, next I will go with the which health education. Okay, so the second unit is from this health education. So health education is very easy. So define health education. We are providing education towards the health, regarding the health. Okay, so aims of health education, objectives, scope of health education, describe the principles of health education, and classify the methods of health education, explain the role of nurse in health education. So differentiate between the health education and health propaganda. Okay, so define health education, explain the principles of health education, and all will be the longest type of questions we may expect. Now it's counseling. Okay, counseling and all you have studied, right? So from the counseling, define counseling, write a short note on counseling, techniques of counseling, and steps of counseling, qualities of a good counselor, role of nurse in counseling. Qualities of a good counselor and role of nurse, both are important. Whatever they may ask, also include this answer, and enlist the role of nurse as a counselor. Okay, so the next one is that define counseling, explain in detail about the types of counseling, briefly describe the role of nurse in counseling. Okay, that much you have to know. Next one, we have the methods and media of health education. Okay, so what are the methods and media we are using in the health education? Okay, so here focus on the AV aids. AV aids is nothing but audiovisual aids, whatever we are using. Types of AV aids, uses of AV aids, characteristics and importance of AV aids. Okay, AV aids is the very important topic or the concept you should follow. Okay, next one, discuss the criteria of audiovisual aid selection. Okay, so everything we are not going to select the same. Okay, so I'm using the digital board as a AV aid. Okay, so I'm promoting something else in the community, I'm using the pamphlet or leaflet. Okay, so certain different, though that selection criteria we have to study. The next one, discuss the different type of and uses of AV aids. Okay, so define audiovisual aids, classification and practices of audiovisual aids in the group, and general public health education. Write a detailed note on the AV aids. Okay, so differentiate between the blackboard and the bulletin boards. Okay, so those are very important. Okay, so next one is that health education and agency resources. So from that you will get short and sorry, 1 second. Yeah. Write a short note on UNICEF and WHO. Okay, and next one is that we are getting this one question, health agencies, WHO, UNICEF. Okay, these are the three important things here. And nutrition, from the nutrition we are getting the questions like first unit is all about the introduction to nutrition. So regarding the definition of food, nutrition, nutrients means water, nutritional status means water, health means water, what is balanced diet, that is important question. Balanced diet means this consists of different foods items in such a quantities and proportions. Okay, so in our plate every quantity of nutrition should be present. Okay, so that is a balanced diet. Okay, calories, proteins, minerals, vitamins and alternative nutrients is met, and small provision is reserved for the additional nutrient to endure the short length of leanness. Okay, so leanness, that is the very important. So here we are expecting the question on short note on nutrition and food habits and customs, and discuss the relationship between the nutrition. Okay, so first unit most of all time we are expecting the questions relation, sorry, this definition meaning we will get one question. Okay, so next one is classification of food. Okay, so foods and animal origin. Foods for example, animal origin means water, milk, curd, ghee, meat, eggs, fish, etc. So these will comes under the animal origin. Then plant origin means pulses, cereals, vegetables, fruits. Okay, so carbohydrates. So these are all comes under the plant origin. Okay, so classification is like carbohydrates, fats, minerals and vitamins and proteins and water are the classification. Based on that only you will get the question. Okay, so lot of things will be there. I'm not going to be tell each and everything, only I will tell you whatever you want. So here we are getting the questions based on vitamins. Okay, so Short type micronutrients, macronutrients, protein, vitamins, you will get the pakka questions from based on those topics. And next one, gynecology live when ma'am. Today gynecology live illada. Liti. Today we don't have a gynecology live. Next one, we have that write a short notes on the following, like we have the short note on functions of protein, fats, sources of protein, discuss the sources and functions of the vitamin A, list the water soluble and fat soluble vitamins. Pakka on vitamins one question will be there. Okay, so describe the classification of food: carbohydrates, minerals, vitamins, water, and then what? Proteins. Okay, next one, define vitamins and write down the types of vitamin. Okay, so these are the very important questions from this unit. Next one is normal dietary requirement, body mass index, everything will comes in this unit only. So we have lot of things to study in this particular nutrition especially. Okay, so lack of time is there. So BMI stands for body mass index. Dietary portion requirement in the adult is, what is the dietary RDA? Okay, required dietary allowances. From this unit of calorie. Okay, so kilocalorie and BMR. Next one, balanced diet is the important question, and weaning diet. Weaning is very important. Okay, so after 6 months of breastfeeding, exclusive breastfeeding, we will start the supplement, food supplements, to introduce the food supplement to the people, to the baby. Okay, so that is what weaning, no, so that you have to write. And factors affecting the BMR, balanced diet, write deficiency diseases of protein. So protein energy malnutrition, kwashiorkor marasmus malnourished will be there, no, that is one difference between the kwashiorkor and marasmus is one of the very much important question. So study that one. Okay, so name 5 disease due to lack of nutrition. What are the measures for the prevention? Okay, so there is a main 5 reasons will be there for to be get the malnourishment in the children, that you have to study and write. Explain in detail about the deficiency of vitamin A. So this much is very important. Focus on everything, that definitely you will can able to write the any questions. Okay, so if you are not studying properly, that is not our fault to pass in the examination. That is the your responsibility to get pass in the examination. Ma'am, I have done second semester previously. Now I have to study for third semester English medium. Huh? What to do now? English medium in which? I have done second semester previously. Now I have to study third semester English medium. What to do now? Regarding what? Regarding what you are asking? Have you studied the things in Malayalam medium? You want to study in now in English medium. I'm thinking you are speaking about the BSc nursing only. Okay, so you want to study means get our application, download in the Play Store, and later on enroll to the courses. Okay, so there you will get the course. You will get in all languages. Next one. Hmm. Food preparation. Okay, so principles of cooking. Okay, so that methods of cooking: moist heat method, dry heat method, with fat. Okay, so boiling, simmering, stewing, parboiling, steaming. Okay, these things will be there. Moist heat method. Okay, next, effects of cooking on food. Okay, so that you have to study. So I will tell you the important question. Preservation of food is very important. Pasteurization is very important. Adulteration is very important. Adulteration must and should, one question you will get. Okay, so the next thing you have to focus on the sterilization, pasteurization, food adulteration act is important. Principles of cooking, methods of you cooking. Okay, so that is important. Explain in detail about the principles and methods of cooking. Define food preservation. What are the principles of food preservation? Explain about the methods of food preservation is the important thing. Therapeutic diet. Okay, so in the therapeutic diet, so this is the diet which we are going to be used for the treatment purpose. Okay, so that is what therapy means, treatment. Okay, so from there what you will get, you will get the things like, write a short note on therapeutic diet. Malnutrition, describe various causes and types of malnutrition. What are the signs and symptoms of malnutrition? Preventive measures for the malnutrition. Elucidate on prevention, elucidate on prevention and control of malnutrition in the community. Role of nurse in a child suffering from the malnutrition situations. Okay, so elaborate the protein energy malnutrition. Protein energy malnutrition, protein energy malnutrition is one of the very much important. Don't forget to study this topic before going to enter to your examination. Okay, so that is very important. Next one is that what are the factors affecting the diet acceptance? Okay, so community nutrition. Next one is community nutrition. From this, see, nutritional problems in India, food hygiene, care, and we have the national programs. Describe any one in detail. Okay, national programs will be there, that is very important. Okay, so long answer, enlist the national health programs, sorry, problems, so not a programs, problems also, and describe two health problems in detail. That is the very important thing in this particular unit. And the last unit is that preparation of the diet practical. Okay, so this is the practical purpose. There is no question they may ask from this. Okay, hope you guys are understood all the things. So what will be happen, I'll tell you something. So here, whatever the community they will ask, also write a role of community health nurse. Role of community health nurse. Okay, at last of the question. Okay, so if when they are asking health education, write about the role of nurse in the health education at last of the answer. Okay, so that is how you have to write it down. Thank you so much for attending the live, and hope you guys are get all the questions where you have to focus more. I think you know. Okay, so it is more than chat gpt, so some things I have explained also, so that you have to focus more, definitely you will get the marks. Okay, thank you so much for watching. Thank you.